Hello, my name's Elham. I'm part of the team here at Hummingbird House, which is Queensland's only children's hospice. We've been asked to share some reflections with you as part of Palliative Care Week this year on the theme, which is that palliative care is more than you think. So typically when people first think of palliative care, they might think around older people or the elderly. But one of the thoughts we would want to bring to the conversation is that palliative care is needed by people right across the lifespan. We support families across the state of Queensland who have children and young people who have palliative care needs, and we try and do that and provide that care in a way which is in keeping with the foundations of the palliative care, but also the hospice movement, which is this idea of holistic care, or care for the whole person. In our case, care for the whole family, recognising that the impact of care on parents and siblings, grandparents and extended family is significant. And while we try and provide that care the best we can, our capacity is also limited, and that's where perhaps you come in as a member of a community across Queensland somewhere. While palliative care is a specialist area of healthcare, the issues it is addressing, the things it's sitting alongside, the reality of illness and death and grief, these aren't specialist medical issues. It's long been said these are whole of community issues, whole of society issues, and perhaps we've become more distant from them in the last couple of generations, and so we often don't feel very familiar with knowing what to do. So this Palliative Care Week, perhaps you might think some new thoughts around what it is that you as a community member, what role you might have to play in supporting people in your community who are in need. One word of caution, however, would be that the first person you ask about what you should do to help probably shouldn't be someone who is living with illness themselves or is a direct caregiver. They've probably got a lot on their plate already. There are some wonderful resources around that you can access through Palcare Queensland and elsewhere that will provide you with some ideas and some resources to think about how communities can support people who are in need. It's just one of the things we often hear from parents and caregivers, both bereaved and non-bereaved, is that having to play the role of kind of educator at the same time as needing help themselves puts them in a bit of a double bind. So if you are sat there thinking, well, I'd like to help, but what could I do? Palliative Care Queensland and other community organisations are wonderful places to reach out to initially to get you connected and plugged in your local area to places that will be able to help. That doesn't necessarily mean volunteering directly with a hospice, but we have so much love for those who do and for our volunteers that help to keep our place open. But whether you're part of a school or a faith group or a sports club, there are roles for people right across the community in supporting those who are living with illness and also living with grief and bereavement. And these are things that parents and families carry with them right through their lives. So as we all do that, I encourage you to think some new thoughts and to care for each other. And thanks for listening.